Hello and welcome to this session on Dementia Support UK with myself, Dr. Julie Christie, and my colleague Una Thompson-Bradley, who you will hear from later. I am the Service Manager International with HammondCare, and in this session I am going to introduce the work of Dementia Support UK, a brand new service funded by Innovate UK and delivered by HammondCare. The care sector across the world has been impacted by COVID-19. Services have felt isolated. Routines and taken for granted support networks have been interrupted. Life has felt very different for people who work in care and people who live in care settings. In this session, we are focusing on England in the UK, which is where Dementia Support UK is delivered. There are 457,000 care home beds across England, delivered by approximately 11,000 care homes. Care homes have been badly affected by the pandemic. A recent study by Deeney and Dunn estimated that we have one of the highest excess death tolls in Europe, with a reported 30,500 excess deaths in care homes in England. The impact of this on those living and working in care homes, families and friends, has been devastating. Whilst the country debates what more could have been done or what could have been done differently, we do already know some of the emerging contributing factors. These include a lack of personal protective equipment, unavailability of testing for care homes, and issues around infection prevention and control practicalities. For example, many care homes were not designed to enable ongoing social or physical distancing. In some care settings, residents share bathrooms and toilet facilities. Care homes are people's homes. They are not hospitals or clinical settings. As a result, staff were not always equipped to deal with infection prevention and control on an ongoing basis. Staff moved from site to site, including kitchen and domestic staff. And people move into care homes even during a pandemic. There has been much debate about whether this should have happened and indeed how it happened. We also know that during this period the need for care homes was considered in some cases to be urgent. The population of residents, therefore, within some care homes also changed during this period. The devastation of what has happened can be summed up in newspaper and broadcast news headlines, some of which we have here. At this present time, there is a risk of reduced quality of care, higher workload for care staff, and interruption to support infrastructures. There is also reduced access to families to support people with dementia alongside care staff. This has resulted in organisational and individual staff stresses. Some care homes won't survive this period as a result of excess bed vacancies. There still remains a high level of anxiety about COVID-19, how best to manage it, and how to get the balance right between infection control and prevention, the need to keep people safe, and respecting the fact that care homes are primarily people's homes. All of this helps us to reflect on the impact of COVID-19 on the care home sector and the impact on care home staff themselves. But what about a personal level for people with dementia? What do we know about this? People with dementia over this period may have had an increased risk of unrecognised pain, delirium, apathy, withdrawal and depression, alongside changed behaviours as a result of the continued dementia trajectory. Disrupted routines and the impact of distancing measures, however well-intentioned, have significantly impacted on people with dementia and their well-being. However, at HammondCare, we believe that seeing ageing with dementia through the lens of understanding complexity, we can significantly improve well-being and quality of life and reduce the inequalities that people with dementia face within the current health and social care system. Dementia Support UK Connect Consult was created to respond to the needs of the care home sector and the staff who work there, as they in turn respond to the support needs of people with dementia in their care settings within the context of COVID-19. Using HammondCare's experience in Australia, we adapted a model of support that would be sustainable during the current pandemic and would help to build capacity within the care sector by working closely with care home staff. I'm now going to hand over to my colleague, Una Thompson-Bradley, to tell you more.
Thanks very much, Julie. To better understand Dementia Support UK, let's meet Michael. Michael was referred to Dementia Support UK because he was unsettled overnight, and his care team were looking for ways that they could help to reduce his distress. They were able to make a referral at 7:30 in the morning, and a DS UK consultant contacted the handover team later that same morning. A video consultation was arranged for 2 days later to help the team develop an action plan. During this consultation, the DS UK consultant worked with the care team to learn more about Michael, who was new to the home, about circumstances within the home, including the impact of any COVID-19 practices and restrictions, and about the behaviour that was causing the team concern. We'll revisit Michael shortly. We know that care is delivered throughout the day and night, and that different care teams have different needs when it comes to information and advice. DS UK has a welcoming and accessible website, and a care team can make a referral through this website at a time that suits them, 24/7. Our resources are also available for download 24/7 at no cost. These include practical help sheets and care support guides, ebooks, spotlights on research and position papers. As well as care home staff, resources can be accessed and used by family carers, as well as other health and social care teams. These have been really well received, with over 750 downloads within the first 12 weeks of the service. And beyond what you find on the website, DS UK consultants also have access to a range of specialist resources, such as screening tools and observation forms. These are provided as part of a personalised consultation with a member of the residents' care team. An example of this is our guided walkthrough resource, developed in response to COVID-19. No matter how long a person has worked in the care setting, the relationship to that environment as a place of work will be very different to that of a person with dementia who lives there. Our guided walkthrough aims to help care staff consider the care home from the perspective of the resident. Dementia Support UK adopts a relationship-based model to supporting care home staff. What do we mean by that? Our consultants work closely with care teams, offering peer support, time and space for them to talk through their concerns about a resident's changing needs and to problem solve together. This involves learning about the carer and the care home to understand the unique context as well as what would help. Through conversation and connection, our consultants model compassionate caring, and in doing so, support the relationships between care home staff and residents. We also offer this same support to our own consultants, who take part in fortnightly focused conversations about their own well-being. Dementia Support UK is helping us learn more about life in care homes during this pandemic, both from the point of view of people living with dementia and of care home staff. Within the first 12 weeks of service, the team has welcomed referrals from small independent care homes and large national services alike. Our referrals reflect the complexity of care in care homes, and we've been supporting teams to respond to an average of 5 behaviours per resident referred. Agitation, aggression, motor disturbance and anxiety feature strongly in the referrals we receive. These behaviours are linked to higher medication use and potential for care home placement breakdown, leading to hospital admissions and/or multiple care home moves. Indeed, a number of residents referred to DS UK have already moved home several times, and almost half of all referrals are to support a resident who's new to the home within the past 6 months. Pain and/or delirium are the primary contributing factors in about 65% of the referrals we receive. And early analysis of referred behaviours tells us that those which have the greatest impact on the person living with dementia are agitation, aggression, anxiety, motor disturbance, nighttime behaviour, or depression. And with the exception of depression, these also seem to be the behaviours that have the greatest impact on carer stress. Dementia Support UK is a service in its infancy, but we're already seeing really positive outcomes for both people living with dementia and care home staff. As part of the service, we reconnect with care homes 2 weeks after our consultation to find out how the resident and care staff are doing and if the advice and resources provided have had an impact. Also, we ask how staff feel about using what they've learned with another resident in their care. From the evidence gathered to date, both behaviours and carer stress have reduced in the majority of cases as a result of personalised consultations, advice and interventions. There's strong evidence of capacity building within care teams, with 73% of staff reporting that they'd feel confident using the advice and resources with another resident in their care. There's also early evidence that DS UK may reduce the use of statutory services, with 73% of referrers indicating that the resident would have been referred to their local mental health team without our input. So what has DS UK meant for Michael and for his care team? On discussion with the care team, the consultant learned that Michael had been a railway worker and would have routinely worked night shifts. Less than a month before, he'd moved to the care home from hospital, where he had been admitted with a delirium. Before this, he'd been living at home with some formal support. The care team advised that Michael became increasingly agitated and distressed between afternoon to evening, with his distress worsening overnight. Care staff advised that antipsychotic medication was having very little effect. He spent much of the night awake. So Michael moved into the care setting very quickly and at a time when he was confused. He wasn't used to living with other people, and he also had untreated pain. All these things combined meant that Michael was not getting to know the care team or his new environment. This referral required a combination of attention to physical health, including pain, sleep patterns and a recommended review of medication, consideration of Michael's life history, the care approaches employed, as well as the care environment. By working closely with Michael's family, the care team was able to personalise his bedroom, replicate his former nighttime routines, and provide environmental cues when it was approaching bedtime. This led to Michael enjoying his first full night of sleep since moving into the home. Staff are continuing to liaise with Michael's GP, working together using information gathered from the screening tools to adjust his care and treatment. The team's drawing on the range of strategies shared by the DS UK consultant to help Michael feel safe and comfortable in his new home. If you would like to read more on this topic, here are some references to have a look at. And if you would like to know more about the work of Dementia Support UK, or if you would like to make a referral, then please connect with us at dementiasupportuk.org. Thank you.